The SNAP Lepto Test is a rapid, in-clinic ELISA that detects antibodies against leptospirosis in 10 minutes. We see cases of leptospirosis all over the United States. Any area that has any kind of standing water and moderate temperatures will have lepto. So it's all over the Northeast, the Southeast, the Midwest, the Colorado area, California, Oregon. Really everywhere but maybe the arid desert has always have lepto. And even there, when you bring in water, you bring in lepto. Interestingly, leptospirosis used to be thought of 20, 30 years ago as a disease of kind of rural hunting dogs, dogs that are out in the fields hunting duck or some kind of other wild animal. And we know now that's just not true today. We see as many urban dogs, if not more, than rural dogs. And we see a lot of small breed dogs with lepto. So this is a disease of every single dog in this country we need to worry about in the inner cities as well as in the more rural areas. Not only do we see leptospirosis in a variety of breeds and signalment, so every dog in this country basically is exposed to lepto somewhere during his or her life, they can also present with a really wide range of symptoms. They can come in with just gastrointestinal signs, with polyuria, polydipsia, with pain, or just lethargy and inappetence. So it's a disease we have to look for really broadly and test really broadly to identify the positives. Historically, this has been a disease that's been very difficult to diagnose. The testing that's been available for many years was the MAT test, the microscopic agglutination test, that's based on incubating serum under different dilutions with bacteria from culture from different serovars. And a positive is considered when 50% of the bacteria in a well agglutinate with the antibodies from the serum. The problem with this test is the results are very complicated. It requires culturing of the organisms in the lab, so only very major labs can even do it to begin with, and their turnaround time is very long. So we have a test that takes a long time to come back, and it's very hard to interpret when we get a positive. Low titers can be false positives. It's affected by many other things, so it's been a very difficult test to work with, and I believe that most veterinarians just avoid it and just don't test for it, and therefore don't diagnose the disease if they're relying on that test alone. More recently, PCR has come into play, and we do have very good real-time PCRs for leptospirosis. And a positive PCR at a good laboratory does confirm disease when the clinical signs are appropriate. The problem with PCR, though, are mostly two things. One, a negative PCR never rules out disease. A negative PCR means that in the blood that was submitted, there's not enough DNA from the organism to call it positive. It does not mean that dog doesn't have the disease. So a positive confirms disease, but a negative PCR does not rule out disease. The other big problem with PCR specifically for lepto is it's very sensitive to antibiotics. So if a dog has been on antibiotics prior to the samples being drawn, it will often be negative. So PCR, although it plays an important role in the diagnosis of leptospirosis, cannot be the mainstay test that we use for leptospirosis. As with most infectious diseases, PCR is most useful early on after infection, while the organism is in the blood in the case of leptospirosis or in the urine. That's why we always ask people to submit blood and urine. And for about the first week after infection, it will be in the blood. And after that, it may or may not be in the urine. So this is a good tool to diagnose the disease very early, which is different than serology. Serology takes maybe a week or two to come up. We have to give time for the antibodies to develop, but then the antibodies will stay up for a longer period of time. So the classic kind of two type of tests that we use are PCR often very early and serology later on. The SNAP Lepto Test is a very important tool that is used in the diagnosis of leptospirosis. A practitioner takes into account appropriate clinical signs, exposure of the animal, appropriate blood work abnormalities, and then the SNAP Lepto Test provides a rapid turnaround, 10 minutes in the clinic or 24 hours at the reference lab as a lepto ELISA, confirmatory test for antibodies against leptospirosis. It's crucial. It's crucial for the health of the animal to provide the correct antibiotics quickly, and it's also crucial to protect the staff and counsel the owners properly. So using this tool as part of our diagnostic process for leptospirosis is tremendously important and helpful. I've been working on leptospirosis for a long time, since 2001. And one of the key deficiencies that has existed really since then in the diagnosis of leptospirosis was a lack of a good test, a lack of a test that gave us a rapid, accurate result. And that's what we have with the Lepto SNAP test. I'm so excited that this test is available. I think it truly will revolutionize the veterinarian's perception of this disease and the ability to diagnose it in the clinic and to provide the appropriate care for our patients.